Now, on the payout, I get this question a lot. What happens to the money? They've earmarked this money for meaningful use incentives. What happens if it runs out? Well, first of all, it is not a Senate appropriation. So that means it is not earmarked. This is all the money that's put in this bucket, and once the well is dry, we don't get to go. This is actually an entitlement program. If you, as a matter of law, meet the qualifications for eligibility and you perform the meaningful use level that's being asked of you for that incentive, you are entitled to get that incentive. So it is an entitlement program, so the money cannot run out. So just to kind of clarify that. Now, when it comes to the Medicare program itself, Medicare pays out typically over the course of 5 years. Now, that's through this year, but the latest you could start Medicare meaningful use, because you have to do 90 days in that first year, would be October 1st, because you have to have 90 days worth of data. These are statutory caps, so the law caps the amount of incentives each provider can get based on the year that they launched their program under the Medicare incentive program. It is calculated based on 75% of that provider's allowable charges for the calendar year. So, for instance, to maximize to hit the $18,000 statutory cap, a provider would have to have claims that total $24,000 or higher. They would cap it out at $24,000, but they're not going to cut you a check till you hit that trigger point, and then they would cut the check. Once I hit 2013, we start to see a decrease. If I'm not doing my 90 days for the first time in 2013, my statutory cap lowers to $15,000, and in 2014, it's $12,000. By 2015, this is when the penalties are required to go in place for Medicare providers. Now, if you are in a health professional shortage area, you would be eligible for a 10% increase across the board.